So many of us have heard the whispers, we have heard the myths that float around about what is and is not possible as we get older. One of the biggest myths I hear is about our smiles. People say that dental implants are just for the young. They say that once you reach a certain age, that door has closed for you. Well, today, we are here to shine a light on the truth. And the truth is this: age is not the barrier you might think it is. Your overall health and the strength of your jawbone. This is not about the number of candles on your birthday cake. It is about the foundation of your health and your desire to live your best life with a full and happy smile. Let's talk about this openly and honestly, like we always do. It is a fact that many seniors are wonderful candidates for dental implants. So, what exactly is a dental implant? Let's put aside the complicated medical terms. Imagine a tiny, strong screw made of a special metal called titanium. This little post acts as a new root for a tooth. A dental surgeon carefully places this post into your jawbone, right where your missing tooth used to be. Your body is amazing. Over time, your jawbone actually grows around this post and bonds with it, holding it securely in place. It becomes a permanent part of you, a sturdy foundation built right into your own body. This is the magic of the process. It is not just sitting on top of your gums, it is integrated with you. Once that little post has healed and become one with your jaw, the next step happens. Your dentist attaches a small connector piece, called an abutment, to the top of the post. This piece sticks out just above the gum line. Then, the final touch. A beautiful, custom-made crown is placed on top of the abutment. This crown is designed to look, feel, and function just like your natural teeth. Look, feel, function. It's more than just a number. It's more than just a number. It's more than just a number. Now we get to the most important question. Is this the right path for you? The first thing your dentist or surgeon will look at is not your age, but your overall health. Certain health conditions need to be managed well for the implant process to be successful. If you have diabetes, for example, your doctor and dentist will want to make sure your blood sugar is under control. Uncontrolled diabetes can slow down your body's natural healing process. Similarly, habits like smoking can significantly impact healing and the long-term success of the implant. Your dentist will want to have an honest conversation about your entire medical history to make sure you are set up for success from the very beginning. The next key ingredient is having enough healthy bone in your jaw. The implant needs a solid foundation to anchor into. When a tooth has been missing for a long time, the jawbone in that area can sometimes shrink or become less dense. Your dentist will take detailed X-rays or even a three-dimensional scan, called a CT scan, to get a clear picture of your bone structure. This allows them to measure the height of the bone and the width of the bone with incredible precision. Do not be discouraged if you hear your bone is a little thin. Embarking on the implant journey is like taking a well-planned trip. It has several distinct steps, and knowing the itinerary can make you feel much more comfortable and in control. Everything starts with the consultation. This is your information gathering session. You will meet with your dentist or oral surgeon. This is your time to ask every single question you have. They will examine your mouth. They will review your medical history. They will take important X-rays or 3D scans. Based on this, they will create a personalized treatment plan just for you, outlining the steps, outlining the timeline, outlining the costs involved. This is where you build trust and get a feel for the team that will guide you. The next stop on the journey is the placement surgery. For this step, your mouth will be completely numbed with a local anesthetic, the same kind you get for a filling. You will be awake, but you will not feel pain, just some pressure, vibration. Many people are surprised at how manageable this part is. The whole procedure for a single implant is often quicker than you might think. Afterwards, you will be given instructions for care and any prescriptions for pain medicine, just in case you need it. Now comes the quiet, patient part of the journey, healing. This is when your body does its incredible work. Over the next several weeks to months, a process called osseointegration takes place, your jawbone growing around and fusing with the implant, making it strong and stable. During this time, you might have a temporary tooth or just a space. You will need to be gentle with the area and follow your dentist's instructions carefully. This healing period is the most critical phase for the long-term success of your implant. It is a time for patience and for letting your body work its magic. Finally, you arrive at your destination, getting your new tooth. Once your beautiful new implant is in place, you have a new responsibility. You must care for it just as you would, or should, care for your natural teeth. Think of your implant as a precious investment in your health and happiness. It cannot get a cavity. However, the gums and bone around it can still be vulnerable to gum disease. A consistent daily care routine is absolutely essential to make your implant last decades or a lifetime. Your daily routine should start with brushing. Use a soft, bristled toothbrush. Use a gentle, low-abrasive toothpaste. Brush at least twice a day. Clean all surfaces of the implant crown. Pay special attention to where the crown meets the gum line. Plaque can build up there and cause inflammation. In addition to brushing, flossing is critical. You may need a floss threader or an interdental brush. Use these tools to clean around the implant and abutment. They remove food particles and plaque a toothbrush might miss. Beyond home care, regular visits to your dentist and hygienist are non-negotiable. Let's have a frank conversation about the cost, because I know this is a major consideration for everyone. It is true that dental implants have a higher upfront cost compared to dentures or a traditional bridge. The price reflects materials, the expertise of the surgeon, advanced planning tech, and that it is a surgical procedure. Costs vary by location, number of implants, and whether you need procedures like a bone graft or sinus lift. Ask for a detailed breakdown: consultation, imaging, surgery, implant post, abutment, and final crown. Insurance may offer limited coverage. Call your provider, ask specifics, and get it in writing. Many offices offer payment plans, and healthcare financing can include interest-free periods.